Hi everyone, I'm Paige Abbott, registered psychologist in the province of Alberta, and today I'm going to be talking about sex addiction counseling and treatment. So as I mentioned, today's topic is going to be on sex addiction therapy. And for those of you out there who maybe are feeling a little bit uncomfortable with the topic, I just want to start off by reassuring you that this is a very natural and normal part of human beings and human existence. And therefore, it's actually a very important part to bring into your recovery from addiction. If you are currently in recovery from any other manifestation of addiction, so alcohol or drugs or food, shopping, work, codependency, or anything else that's been prominent for you, I do encourage you to not only watch this video, but perhaps look at bringing in sex addiction, counseling and treatment into your current recovery work. Everyone benefits from this who has addiction, is in recovery. Sex addiction treatment is not just reserved for people who recognize that their issue with sex has become unmanageable. How come this is the case? Well, if we think about it and just step back for a minute, addiction is a brain-driven issue. So it resides primarily and impacts the reward circuitry of the brain. The reward circuitry of the brain is what was evolutionarily created to have us survive. So that part of the brain actually controls our basic drives for, you guessed it, food, but also sex and reproduction. So therefore, to me, I'm a straightforward, kind of logical person. It just makes sense that if the same circuitry that has been impacted and is manifesting in other areas of your life, how would it not be having some sort of impact on your relationship with sex? Now, with sex addiction, it can go on either side of the continuum from anorexia all the way over to binging. I think often people will only identify having issues with addiction involving sex if they're on the binging side of the spectrum. And I can, to a certain extent, understand the rationale behind that. Usually when people are binging on a behavior, there's a lot more impactful consequences that come from that than when they're on the anorexic side of the spectrum. Now, I would say that there are actually a lot of consequences that do come when you're on the anorexic side of the spectrum. However, those consequences may not be as overt and as obvious to others, and that can be more comfortable to people. I think a lot of people, especially people with addiction, are much more comfortable to have the pain be internal. That's often something that people have lived with pretty much their whole lives, so it's almost something that they're used to, rather than the pain be external or impacting people around them. So I think that's actually a huge reason why anorexia side of the sex addiction spectrum really goes unnoticed, unreported, and undertreated. Sex addiction as a whole is very much undertreated, and I think there's a lot of reasons for that. A big one is that I think a lot of providers aren't comfortable to talk about it. They may not be skilled or experienced to talk about it, and there's this debate in the psychiatric community, which has spilled over into the psychological community of, is sex addiction even a real thing? Personally, I think that's a ridiculous conversation to have. I truly don't understand how people could take the stance of, no, it's not. I think that's just based on the work that I've done for over a decade with people who've struggled with addiction. And if you ask someone who presents for alcohol use issues or substance use issues what their relationship is like with sex, guess what? Lo and behold, there's issues and there's challenges there as well. Plus, there's a whole lot of people who present to counseling to primarily deal with issues with sex, because that's been the main thing that's been causing issues in their lives. So personally, I feel like that's an argument that needs to be put to bed. But I do understand that some people are still in that place of questioning and debating, is this even a real thing? To me, sex addiction very much follows the addiction path and framework, in that it can certainly lead to feelings of unmanageability. People often feel out of control with that behavior. It can become very obsessive, take up a lot of thinking, feeling, airspace. It can become very compulsive. It's something that people may not feel that they can impact or have a healthy relationship with. It's also something that people carry a lot of feelings about, a lot of fear, a lot of shame, a lot of guilt, a lot of remorse, and more than that, and any other feelings that come up are to be anticipated as well. A lot of people who struggle with addiction, if they look back at their sexual and their relationship history, I've had many folks who will report they actually don't feel they've ever had a healthy relationship, nor do they feel that they've had healthy sex. For them, often maybe sex started with some abuse, so the templating that happened there becomes quite distorted and dysfunctional right from the get-go, because now they're learning about sex through an abusive power dynamic, often with somebody that they trust or trusted, and that can really impact their feelings and their behavior with sex for forevermore, if they're not looking at it, or for a long period of time afterwards. Sex can also start to become integrated with other behaviors that people are struggling with. So I have had a lot of clients who have actually never had sober sex. So sex has always been paired with drug or alcohol use. And so learning how to engage with sex, which is a very vulnerable, a very intimate act, can take a lot of practice, a lot of kind of growth and personal development to be able to get to that spot of engaging in a healthy relationship and a healthy sexual relationship while feeling comfortable. Because again, a primary part of sex is intimacy. And for both men and women and other gender identities alike, the emotional intimacy framework is key for a healthy sexual relationship. Emotional intimacy, how to connect with one's feelings, identify one's feelings, communicate about one's feelings, are often a significant challenge for people who have addiction particularly, but also for people who may have grown up with other mental health issues and in dysfunctional environments where they never learned that language. The bright side of things is that all of these things can actually be learned wherever you are, at whatever age and phase of life you're in. So even if you feel you're later in life, if you have the motivation and the desire to make some changes and connect more with your emotional world and be able to have healthy relationships, whether the goal is to lead to healthy sex or simply to lead to healthy relationships, it's definitely possible. Younger years, definitely possible. What it takes is that determination and that recognition that you want something to be different, and then finding the appropriate supports to guide you in that process of change. And those supports may be professional, they may be informal supports, so friends and other people around you that you can talk to about these issues. And they may also be support groups, so peers who have been in a similar space to you and can share and learn from you, and you can learn from them. I actually recommend, for really great sex addiction counseling work, that all of those pieces be integrated into your framework. Relying on just one or two of those, you may not get as much information or as much benefit or change as you're hoping for. So what are some elements of sex addiction counseling? Well, of course, every therapist is going to be different in their approach. There are certified sex addiction therapists out there who are going to follow a bit more of a structured framework based off of the work of Dr. Patrick Carnes. And there's others like myself who have built together a more eclectic approach, really that is client informed. So yes, of course, there's a professional backing and a theoretical approach behind the work, but I have learned from all of you and everyone that I've seen over the thousands of hours of counseling that I've done, listening for patterns, understanding the themes and the symptoms and the challenges that come up for people, and also hearing and seeing what works and what helps. I think a common myth of sex addiction counseling is that the professional is going to recommend now that you be celibate or abstinent. And I think a lot of people have that fear because other manifestations of addiction, like substances in particular, may ask for or require abstinence as the goal moving forward. You may have got to the point where you feel no use is really the only option for you. Some people do get there with sex, and that's a decision that they've been kind of forced to make, but are also comfortable making because that's what feels best for them. People do not want to deal with the unmanageability and the wreckage that comes with their addiction being active in this area. However, I would actually say people who commit to an ongoing path of abstinence with all parts of a sexual relationship is very rare. More so, what I've observed and seen effective is people who are looking at the unhealthy and the unhelpful parts of their sexual relationship and pursuing abstinence with those, while really trying to grow and nurture and develop the healthy parts of the sexual relationship that they want to have. So often in the abstinence pursuit side of things, often those behaviors are things like pornography use, sex with self, sex outside of a committed relationship, sex with paid escorts or sex workers, things like that, where people feel like those really are some of the behaviors that for them feel outside of that domain of a healthy relationship with sex. And that's personally driven and personally defined. So that's the reason that it can be helpful, especially to bring that professional person in. Often people don't necessarily feel comfortable talking about these sorts of things with a friend or a family member, and they may not yet be at the point where they have some peer support. So talking with a professional who has some understanding of addiction, as well as specifically sex addiction, can be helpful to just start to clarify what your goals and your boundaries are that you want to work towards. And what starts to happen in that healthy sexual relationship work? Well, that's where some of the work I mentioned earlier starts to get done. So it's emotional work, starting to work on building a greater connection and identification of your feelings so that you're more attuned to what's comfortable and what's not comfortable for you in all parts of your life, but that also applies in the relationship with sex. Again, if people have experienced abuse or there hasn't been sober sex in the past, people are very disconnected from themselves during those sexual moments and therefore really don't have a lot of knowledge about their feelings, their comfort, and their needs in that sexual environment. So being more connected with feelings allows people to be more attuned to what's working and what's not working for them, including what's safe and what doesn't feel safe for them. As well, in that healthy sexual relationship realm, working on healthy and assertive and open communication is also a key thing. So once there's more awareness of feelings, there also needs to be the ability to share and communicate about those feelings with your partner and those who are key to your healthy sexual relationship. So that may also be your professional supports and peer supports that you're working with so that they can also be supporting and providing feedback and just giving you that place to practice that assertive communication. So being very clear with yourself and then being able to be clear with another about, again, what feels safe for you, what's comfortable, what your preferences are, what you need. Another key thing that needs to be part of that healthy sexual relationship work is working on building up intimacy. So really working on building up comfort, even being physically close to somebody. Someone who's had a lot of abuse in their past may not even be comfortable with touch. So hand holding, shoulder touching, hugs, kisses, these elements of a relationship, which don't have to be part of the sexual relationship, but can be and can lead to that, is very important for people to identify, again, what they're comfortable with and what they want to work with in terms of building up that comfort and that safety. So working on physical intimacy and safety, working on emotional intimacy and safety. So building a friendship, building a quality relationship with your partner so that there's that foundation laid to step into that sexual relationship which might feel a bit more vulnerable for you. So the thing I love about doing sex addiction counseling is, much like all other parts of addiction counseling, is you get to talk about so much and you really get to explore some very core parts of the person. And for you out there, if this is work that you're considering doing for yourself, I know it can feel a little bit overwhelming, but rest assured that it'll be done step by step and gradually. You're not just going to be pushed into the deep end of the personal development pool. And if you are, I would say find some different supports so that you feel safe and comfortable in the guidance and support that you're getting. But as these things start to grow, it's extremely liberating and it's very exciting to know that you have changed and shifted a relationship with a behavior that you may never have felt you were on healthy footing with. And believe me, it is absolutely possible. Thank you so much for tuning in. I wish you all the best in your wellness and your health journey, and take care. Bye for now.